So hopefully everybody can see the slide right now on the screen that says midpoint summary. And so just to kind of remind everybody what's been happening as we build up to cognitive restructuring skills training, we start off with our engagement phase, which is really critical to establishing trust and rapport. You would never proceed into cognitive restructuring if you felt that trust and rapport was compromised. And so we're really, making sure that the client is invested and, really trusts us. And in that phase also, and this sort of blends into our more formal assessment phase, we're asking a lot of those Socratic style questioning to understand what are some of the thoughts that seem to be really important perpetuators of distress. What are the thinking styles that are at play? And, really, how did these kinds of thinking styles or specific kinds of thoughts develop, looking at early childhood experiences or other salient events in the person's life to understand those core schemas, which are really those strongly held unconditional beliefs that develop through early experience. Then in our assessment phase, we're seeking to I just said assessment phase. Then that all leads into defining the problem and goal list. So how is this thinking style or behavioral sort of behaviors causing problems, and what is motivating the client to change? What are their values, and then what goals do they have for themselves that are consistent with those values? And then what are the short-term treatment targets that we can reasonably accomplish together? And these are almost always going to be things that are presenting barriers or obstacles to the person's recovery goals. So the voices, those are the psychotic, mood, substance use kinds of treatment targets. And then in our intervention phase, I'm just focusing on our cognitive interventions, not behavioral here, given the topic. We're monitoring and identifying distressing thoughts through something like a thought log. We are teaching the client how to develop alternative explanations. And here we're going for some enhanced mental flexibility. And then we start to help the person to evaluate their own thoughts and beliefs. We might need to do some additional work here. So for folks who struggle to identify thoughts related to different emotions, we can use the guide to thoughts and feelings to help them identify the kinds of thoughts that are associated with different emotion states. For some of our clients, we might even need to get more basic than that, where we're actually just teaching them what do different emotions feel like in our body so that they can better identify what kinds of distress they're experiencing and therefore the kinds of thoughts that go along with that distress. And then we will, for many of our clients, although I think that there are some clients where they're going to get overwhelmed by it, we might be able to justify, strategically omitting our unhelpful thinking styles handout. But when we introduce cognitive distortions, what we're trying to emphasize is this idea of universality. We're all prone to different kinds of thinking errors. And when we notice a thinking error, then it's just a signal to ourselves to stop and take a closer look at what the actual thought was, so that we can make sure we're kind of taking it all into account. You might find it helpful to use the detective work handout, which is in your online repository and in your skills binders, really to kind of help you teach the rationale for cognitive restructuring. It is not that your thinking is faulty, it's that all of us are prone to some thinking errors that when we don't stop and take a closer look at it, we can actually get quite swept away with some of these thoughts. And so all we're trying to do here is really slow it down, take a closer look, and be critical thinkers. And our emphasis is on reducing the distress and impairment, of course, caused by ruminating on thoughts that trigger painful emotions or acting on thoughts without having all of the information. So I have some examples of the kinds of questions here that might help the person just build some internal motivation to work on evaluating thoughts with you. Some cognitive restructuring tips. So One is the more specific the thought, the better. Oftentimes we get into trouble when we go down the 5 steps of CR and we're working on this very generic thought, and we're struggling to come up with evidence that supports it or doesn't support it because it's just so broad and vague. Similarly, the more extreme the thought, the better. So anytime you've got always or never in the thoughts, those are good examples of times when it's going to be pretty easy to with collaboratively identify some evidence that does not support the thought. You just got to find that one exception. That's a pretty low bar. There are times when you may not have enough information about the situation that cued the thought. So a classic example that comes up a lot in our group CBTP echo clinics is, talking about a situation where the client believed that aliens put a probe in his head, and that when he first developed this idea, if we were to have asked him more and more questions about when that developed, it was actually while he was at a bar after just getting laid off from work. So a number of variables that we now know about that can really help to maybe start to seed some doubt or ask some important questions about the information or kind of the environmental factors that were playing into that, the development of that belief. You and the client may not have all the information that you need to adequately explore the evidence for and against within a given session. And so even though as a general rule, we try to get through a 5 steps of CR in a session, it's okay to say, I think we need some more information here, and I'm wondering how we might go about getting more information. What are our sources that we should be consulting with? And then how do we get to those sources? And then actually assigning one another the task of gathering more data. And it's a great way to model to your clients that process of just going outside of the information that's immediately accessible to them in the spirit of, doing that detective work. You will need to prompt the client to help them generate evidence. This is, more or less a rule, but hopefully what we're seeing as we're shaping the behavior is that your need to be more directive or suggestive in that phase of the CR will become less and less over time as the client's thinking is becoming more flexible, and as they're learning what kinds of evidence are, it's what you're looking for. And then I think it's always helpful to have some catchy prompts to cue the CR process. So one that I have often used is just because I think it doesn't make it true, which could also be a positive coping statement, right? They could just stop with that, but they could also use it as a cue to actually do a 5 steps of CR. And then what would Judge Judy do, right? Remember, we talk about good quality evidence. What is she going to allow in her courtroom? So let's see an example. And then, last clinic, we did a role play where I primed Gloria for a 5 steps of CR because the voices were telling her, don't do that. This time, Jeff is going to take that a little bit further, and we'll all either have that go into a full 5 steps of CR, or we'll carry that over into our next clinic. All right, so the steps of the 5 steps worksheet should look very similar to a daily thought record. It's just so much more explicit and laid out in a much clearer way than a daily thought record. And this is because we want our clients to over-rehearse a skill that they are learning. So we want them to break everything down and to practice it just like it is on this worksheet, knowing that eventually they're not going to need to literally go through this worksheet each and every time. So for this first situation, let's say the situation, again, just the facts, not the interpretation, is my neighbor's light was shining through my window. It woke me up. Then we want to have the client identify the feeling and preferably the intensity of that feeling. So they were feeling quite anxious and they were feeling pretty angry. And the thought was, the neighbor is using the light to put more babies in me, which I believe or the client believes at 90%. It's a really high conviction. We pull out the unhelpful thinking style handout. and client identifies overestimation of risk. I typically don't spend a lot of time on this one. If they have identified that there is a thinking style at play here, that's usually good enough. And then we dive into step 4, right? So step 4 is a really important part of the process. So we want to start with the evidence that the person does have for this thought, really writing down all of the evidence that they can think of, and then you can decide, it's sort of a stylistic question about, do you, if you're seeing things in the evidence that supports that represents another kind of cognitive distortion, do you address that now or do you wait until the end? I think it depends on how proficient the client is at this process. For my clients that have done this a lot, I might say, that sounds a little bit like something that might show up on our thinking styles handout. Do you have a sense of what that might be? And I say, oh yeah, I know, it's all or nothing thinking. For clients that are just getting their feet wet with it, I really want to build mastery here. I'm going to let them get it down. I'm going to then move to things that do not support the thought. But before we evaluate the evidence, I want to go back to the things that do support the thoughts, and I want to see whether we can, whether it would be Judge Judy kind of evidence. So in this case, let's say the client says, well, the things that do support my thought are, I can feel the babies inside me, my neighbor has been messing with me for a long time, my belly looks pregnant, I'm tired all the time, I have bad gas. These are all the things that let me know that not only am I pregnant, but that the neighbor is responsible for the pregnancies. So you can see there is so much here that we're going to feel like really tempted or compelled to start to poke holes in. And I think we have to use our clinical discretion as far as how we, when we do that. But certainly that is something that we would want to do. So let's say we proceed for now with generating things that do not support the thought. The client says, well, all the pregnancy tests that I've taken are negative. It's possible that I'm tired because I'm not sleeping well. Gas bubbles might feel like the baby moving, and lights don't typically make pregnancies happen. I know there haven't been any cases in the medical literature of this, and the doctors keep telling me that. Okay, so now I want to go back, and she's already kind of done my job for me in terms of identifying some of the holes in some of this evidence, right? So it is true that you've got gas, and that, oftentimes, that could be a side effect of pregnancy. And it's possible that sometimes those gas bubbles are making you feel like there's a baby inside, right? Or, are there other reasons that, maybe people do tend to get bouts of bad gas, right? And then you would identify all the reasons there. Or that really also leads to the discussion around, I can feel the babies inside me. Well, that might have to do with the gas. Okay. So then you want to coach the person around really thinking critically about the evidence. And we really want to be maybe even like generating what from this original list still stands, and then you could write it in that column so they know what are the things that they are deciding is evidence that supports the thought, what doesn't. And then it's okay here if you need to get more information, but based on the information that you've had and reviewed together, where do the chips fall, right? Does the evidence mostly support the interpretation that the light shining through the window means that your neighbor is impregnating you? Or do they mostly not support that thought? Now, keep in mind, there's a lot of pieces to that, right? So she could decide, well, I do think my neighbor is shining a light through my window on purpose, but I don't know that it's leading to me, it's leading to pregnancy. So there's a lot of different ways that could go. If there's any alteration to the thought, that's a no, and they're in charge of that new thought. And we really have to not have a dog in this fight, because at the end of the day, the best restructured thought is the thought that the client buys into. And so I think it's critically important that we let the client identify that thought. We can fine tune it, we can shape it, but we need to check in with the client about how much they believe that new thought. So in this case, the person says, I feel like the neighbor is messing with me and may be putting babies into my belly. I don't know for sure, which is leading her to feel very confused and worried. This is a good example because it shows how even when the evidence on the whole does not support the thought according to the client, you would still want to follow up with an action plan. She's still indicating a lot of distress, even though she has altered the belief. And so you'd move into your action plan thought. And then I think while you've got the momentum there, you'd consider following up with the question, given that this might not be the case, can we think through some other explanations for the light shining through your window? So your role, creating a safe and understanding place for the person to be vulnerable and to learn more about where these thoughts, beliefs came from, what leads to them, what makes them worse, and then how to evaluate them. And also to actively guide this process. So while it is true that we have to, be open to however this plays out, we are going to help the client to generate and evaluate the evidence, by being actively involved and develop evidence against the belief, gently challenging the client's evidence for the belief, if warranted, and gradually decreasing your directiveness over time as the client learns how to do this more independently. I think it's really important to emphasize that this is a skill and we're not trying to change their beliefs. So it's really just about evaluating the beliefs and making a decision for yourself, which is quite empowering. And then also just making sure you're getting through all the steps whenever possible. If you do have to leave something on the table, I would say you have to figure out how proficient are they in the skill now to decide whether or not to assign that for home practice, because we try to avoid assigning anything new for home practice, particularly when it's high stakes like CRs can be. Just a small tip, write the original thought on the top of page 2, because otherwise the thought starts to get a little distorted or changed. We want to stick with that original thought, assuming we've really clarified the thought as well as possible. Make sure you're pausing frequently to review. Make sure you're asking questions, not planting information or seeds. If they're identifying anger as the primary emotion, then usually that's a secondary emotion. So what else was going on? What other emotions were at play? Lots of guidance around finding a workable thought. And I won't go through all of these in depth because I'm running out of time here, but I already talked about the guides to thoughts and feelings. It's really important. We oftentimes will have our clients say, well, I was thinking, what if everybody thinks I'm a loser? And it's hard to work with a question, so try to turn that into a statement. And how would you answer that? What if everybody did think you're a loser? Well, then it would really be true. I'm a good for nothing. I don't know if we've talked about this, but the opposite technique can be really helpful when the client is having trouble identifying the thought. So let's say the client is, they went to a party, they got really overwhelmed and they left, and you're trying to get at what went down at that party. They just are drawing a blank. I don't know what I was thinking. I just felt like I was going to have a panic attack, and so I left. Well, were you thinking you were feeling really, confident at that party and really like everybody wanted to talk to you? No, I thought that everybody could hear my voices and, they were going to point and laugh at me. And then making sure that you're asking clarifying questions so that you're really understanding the relationship between the thought and the feeling, right? What about the thought is distressing? So much of the time we assume we know until we don't ask the question. In CBT, we try to train ourselves to put our assumptions to the side and ask, because we really could be wrong. So if the person says, I can't be happy, we might think that they mean they can't ever be happy because they have a diagnosis, but what they mean is, I can't be happy because the voices will always torment me. Those are very different 5 steps of CRs that we've just identified. All right.